Hello, welcome, I'm Danica. This is a short, gentle practice to support your lower back and sacroiliac joints, or SI joint. We'll begin with some slow movement to circulate the synovial fluid through the joint and warm the connective tissue. And then towards the end of the practice, we'll move into longer held poses so that we can safely support the SI joint, sacrum area, and lower back. This practice is suitable for all levels. If you have a blanket nearby, go ahead and grab it. Let's get started. If you have sensitive knees today, you can place this blanket down underneath of the knees. Otherwise, you can set it off to the side and we'll pick it back up a little later in the practice. Make your way into a tabletop, hands and knees. And we'll begin with some hip circles, and you can make these as big or as small as you want, sending the hips back towards the heels and around in a big circle. Try to move a bit slow here so that you can really feel the subtle stretch in the side of the body, the back of the body. Also slowing down and deepening the breath. Reverse the direction. And then we'll meet back in our neutral tabletop. Inhale, drop your belly down, lift the crown of the head and the tailbone. We'll stay in our cow pose, but start to sink the hips back towards the heels and just allow the spine to naturally round as they move all the way down towards the heels. So your spine will round all the way up to the crown of the head. And then staying in your rounded spine, inhale to lift up. And exhale into your tabletop. Inhale into your cow pose. Stay in your cow pose as you sink your hips towards your heels, letting the spine naturally round. Inhale, lifting up with your rounded spine. Exhale, tabletop. Inhale, cow. 2 more on your own. And we'll meet back in our tabletop. Walk the hands out in front of you, keeping the hips in the air. Melt your heart down into your puppy pose. 3 slow breaths. Try to draw the lower belly in and up so that we're not dumping any weight into the lower back or SI joint area. On your next inhale, walk the hands back in towards your body. And then we'll cross the ankles to come sit back behind the heels, making your way into a comfortable seat with your legs crossed in front of you. Very gentle twist here, so trying not to involve the lower back at all. This is just about the thoracic spine, the upper spine. So keeping the hip points pointing forward, bring your right hand to your left knee. Left fingertips back behind you. Try to stay steady in the low back as you gently twist over towards the left. You don't need to go 120% today. Just go until you feel sensation and then breathe. Inhale to unwind. And exhale in a neutral spine. Left hand to the right knee. Hip points stay pointing forward. And then very gently as you exhale, twist to the right. So if you have anything going on with your low back, less is more. It's important not to baby it. You do need to keep it moving for it to heal, but you do need to do less. Take one more breath here. Inhale to unwind. And exhale, neutral spine. Bring the soles of the feet on the floor in front of you, the knees bent, and you can place the fingertips back behind you, fingertips pointing towards your body. Walk your feet a little bit wider than your hips and let your knees fall in towards each other. You can puff up in the chest, and you're very gently going to windshield wiper the legs back and forth, so your movements can be small like this, or if you have a little bit more movement, you can drop the knees all the way down. Again, just moving really slowly. This is a good way to massage the glutes too, which plays a big part. The psoas muscle plays a big part in your lower back health. And then we'll come back to neutral. So for this next part, you have an option to stay upright and lifted if you want to get a little bit more into the hips, or you can come to lay all the way down on your back for a figure 4 stretch. So if you're doing it on your back, it's the same exact principles, except you'll be on your back, but we're crossing our right ankle over the left knee and flex the right foot so that you can keep that right knee protected. And then you can play around with where your left foot needs to be in order to feel more or less sensation. So you can walk it towards you. That's obviously more intense, or away from you for a little bit less intensity. If you're on your back, you can straighten your left leg, or you can keep it bent, or you can keep your left foot on the floor. Just take a couple breaths here. Your right knee is gently moving away from you. Then we'll gently release the right foot down, crossing the left foot over. This side might feel different than the other side. We all have a problem child side. So make sure that you keep the left foot flexed, protecting that left knee, and then play around with where you want this right foot to be. And then breathe. Releasing any tension you're holding in your jaw. Try to soften in the hips. And then we'll gently release the foot down. You can do this part staying on your back or seated. If you're seated, we're just going to bring the soles of the feet together, but the soles of the feet are going to be a little bit further away from your body. And then we'll tilt our pelvis forward a little bit, lengthen the spine a lot, and you're welcome to just stay here and work on allowing the knees to settle. Or you can start to fold forward a little bit, but make sure that if you are folding forward, you're keeping a lot of length in the spine. If you're on your back, you're doing the same thing, bringing the soles of the feet together and the knees fall out to the side. You can also bring the soles of the feet in towards the body, pressing the knees away with the elbow. Just taking one more deep breath in and out. Inhaling to come all the way up if you've folded. And then grabbing a hold of our blankets. If you're lying on your back, you can roll over onto your side and push yourself up. So placing the blanket down lengthwise, the same as the mat, we're gonna use it for a supported child's pose. So bring the knees a little bit wider than your hips, your toes can touch, and then we're just gonna melt over the blanket, bringing one side of the face to the mat. And we'll be here for a few breaths, and I'll let you know when to change and look towards the other side of the mat. Just breathing into the back of your body. Slow, full breaths. Go ahead and change the direction of your gaze, moving your other side of the face to the blanket. Very slowly start to walk your hands back towards your body. Take the blanket, we're going to use it again. We're going to make a little shelf, so this time the blanket is moving perpendicular to our mat. And we're going to place it underneath of our hips, low back area. Coming all the way down onto the mat. Walk the feet a little bit wider than your hips, maybe even as wide as the mat, and let your knees tent in towards each other. Just for about 3 breaths, breathe here. This constructive resting pose is really a wonderful pose to help give the SI joint some space. And then heel toe the feet back in towards each other. You can play around to see if this is comfortable for you. So one option is to rest with the knees in towards each other, or you can extend one leg long and keeping the left foot on the floor. Just allowing the hips to settle here. If this is okay and you want to take it a little bit further, you can draw the left knee in towards your body and just move it around in little tiny circles. You're also welcome to just stay still, hugging the knee in. So listen to your body. If it feels like it's screaming or a lot of sensation and you've gone too far, backtrack. Lower the left foot back down if it's lifted. Slowly draw the right foot back onto the floor. Pause for one deep breath in and out. This side might be different than the last, so listen to your body. You can extend the left leg long, and you can just pause here. Even if it doesn't feel like a lot, it's still doing quite a lot for your SI joint. But if you want to take it a bit further, you can draw the right knee in and just making those little tiny circles with the knee, or stay still. Take one more breath here. You can lower the right foot down first and then slide the left foot to meet it. A few options here. If you like the feeling of the shelf underneath of your lower back, then we'll stay here for our final rest. Or if you want to come flat on the floor, you can push down and lift the hips up and remove the blanket. Set it off to the side and extend the legs long, or you can keep the knees bent. If you're keeping the knees bent, just make a little tent with the knees, placing the feet wherever is most comfortable. Letting the knees fall in towards each other. You can rest your hands wherever is most comfortable for you and close the eyes. Just giving yourself a minute or two here to let the practice integrate. Minute of stillness and silence. When you're ready, you can reach your arms up over your head, gently waking the body back up again. And in your own time, rolling over onto your side, resting in a fetal pose for a moment. And gently pressing yourself all the way back up into your comfortable seat again. Keeping the eyes closed or soft, just staying in this meditative state. Taking a moment to notice any changes you feel due to the efforts of your practice. On your next inhale, reach your arms out wide, circle them up over the head, palms connect. Exhale, draw it down in front of the heart. Blinking the eyes open. Thank you so much for sharing this practice with me. I hope that it was helpful, and I hope we get to practice again together soon. Namaste.